Chief Complaint: I'm itchy and I have a rash by Lena Hall. For the comprehensive HPI, the patient is an 88-year-old Caucasian female presenting to the family practice stating, I'm itchy and I have a rash. The patient presents to the clinic for a rash that has been itching for months and months. The rash is on her legs, her forearms, and her head. She states that she is very itchy and is very painful. The patient further explains she has tried over-the-counter itching creams and nothing is working. The patient denies any previous history or previous treatments to this condition. The patient states the condition has gotten gradually worse within the last few months and she cannot stand the itching anymore and needs sleep. The patient indicates there were no modifying factors and the severity of the condition has slowly become worsening. The onset is unknown and she has no known allergies. In the review of systems, the constitutional denies fever or chills recurrent to fatigue or malaise, headache, sweats, anorexia, fatigue, weakness, or weight loss. For the ears, eyes, nose, and throat, she denies vision changes, slight sensitivity, eye pain or irritation, double vision, vision loss, hearing changes, ringing in the ears, ear pain, nosebleed, nasal discharge, nasal congestion, non-healing sores, sore throat, difficulty swallowing, tooth pain, non-healing sores, or oral lesions. For cardiovascular, she denies chest pain or pressure, shortness of breath with normal activity, elevated blood pressure, difficulty breathing with lying flat, shortness of breath at night, shortness of breath that wakes you up from sleep, palpitations or sensation of heart beating in your chest, swelling in the ankles, lightheadedness or weight gain. For respiratory, she denies shortness of breath at rest or with exertion, cough, a productive cough, difficulty breathing, wheezing, excessive snoring, shortness of breath, excessive sputum, chest discomfort, coughing up blood, sleep disturbances due to breathing. For gastrointestinal, she denies heartburn or acid reflux, difficult or painful swallowing, nausea or vomiting, diarrhea, constipation, abdominal pain or cramping, bloody or black bowel movements, excessive appetite, loss of appetite, indigestion, nausea, gas, hemorrhoids, and change in bowel habits. For the genitourinary, she denies painful or difficulty urinating, blood in the urine, frequent urination, incontinence, urgency, incomplete bladder emptying, and hesitancy with urination. For the musculoskeletal, the patient states she does have chronic back pain. For skin, it's very pruritic rash predominantly on her forearms and legs and is also affecting her scalp. Neurological, the patient denies frequent dizziness, fainting, weakness in arms or legs, numbness or tingling in arms or legs, headaches that are not new or changing in frequency, difficulty with concentration, memory loss, sensation of room spinning, tremors, visual disturbances, weakness, inability to speak, and seizures. For psychiatric, she appears very anxious, but denies depression, hopeless, suicidal thoughts, mental disturbances, hallucinations, financial hardships, not feeling safe at home, social problems that interfere with your mental or physical health. For the patient's physical exam, she had a normal blood pressure of 134/68, her pulse was 82, respirations were 19, a temperature of 98 degrees, and her O2 stats was 96%. Her weight was 97.4 with a BMI of 19.46. In general, the patient is appropriately dressed, appearance is clean and kept, patient is a thin white female, does not appear to be in distress, patient is alert and oriented times 3. Her neck is supple, no masses of palatal cervical nodes, trachea is midline, thyroid without nodules, masses, tenderness, or enlargement. Her lungs are mildly diminished breath sounds with prolonged exasperating phase, no added sounds. Her cardiovascular is a normal S1 and S2, no rubs, no gallops, no murmurs or carotid brutes. Musculoskeletal, there's no deformity of scoliosis notes, normal range of motion, joints normal, no arrhythmia, edema, effusion, or ecchymosis. Neurologic is grossly normal. For the skin, the patient has multiple areas of ecchymosis, which appear to be a secondary to chronic scratching. Her left forearm has white patching and the white excessive in the skin excessive excoriation. The labs that were to be ordered for this patient was a rheumatoid factor, or RF. This blood test checks for RF, an antibody that many people with rheumatoid arthritis can eventually have in their body. Not all people with rheumatoid arthritis test positive for RF, and some people test positive for RF but never develop the disease, and some people test positive but have another disease. In rheumatoid vasculitis, it can be a rash that is painful and itching. The patient also had cyclic citrullinated peptide antibody. This blood test checks for CCP antibodies, which appear in many people with rheumatoid arthritis. In addition, CPP can appear before rheumatoid arthritis symptoms develop, which can help doctors diagnose the disease early. The patient also had a complete blood count test. This blood test was measuring different cell counts that can help diagnose if there was an infection in place, etc., that could be causing the itching. We also had prothrombin with INR and PTTs, a screening test for abnormalities of coagulation factors that are involved in extrinsic pathway. The bruising or pooling of the skin is believed to be from excessive scratching, but this was ordered to monitor to ensure it was nothing more. We also ordered erythrocyte sedimation, or the SED rate, that this test measures inflammation of the body and monitors disease activity in response to treatments. And C-reactive protein. This is another common test for inflammation that can help diagnose rheumatoid arthritis and monitor disease activity in response to treatments. For the differential diagnosis, we first had rheumatoid vasculitis. Rheumatoid vasculitis is a condition that causes inflammation of small or medium-sized blood vessels. It happens in some people who have had rheumatoid arthritis for a long time. We also have the atopic dermatitis. Atopic dermatitis is a condition that causes dry, itchy, and inflamed skin. It is common in young children but can occur at many ages. Moisturizing regularly and following other skincare habits can relieve itching and prevent new breakouts. Next, we have brachioradial pruritus, which is a neurological condition that causes itchiness and other abnormal sensations in your forearms. A combination of cervical radiculopathy and ultraviolet radiation exposure causes it. And finally, we have psoriasis, which is a skin disease that causes rash with itchy, scaly patches that most commonly on the knees, elbows, trunk, and scalp. For the medications that were prescribed for the patient was instructed that she could use NSAIDs, which can help relieve pain and reduce the inflammation. She was also prescribed doxepine for 25 milligrams, which can help the patients with anxiety while also blocking the histamine and substance in the body that was causing symptoms such as itching. And she was also given ketoconazole shampoo, which is an antifungal medication which can be used to relieve the flaking, scaling, and itching on the skin. The patient was instructed to put the medication on her scalp and rub it on her topically on her skin and have it sit on her skin for a few moments to help with the itching. She was also reassured by the doctor, and a lot of time was spent with the patient by the physician, explaining he was going to figure out what was causing this because the patient became tearful and explaining she had already saw another family care practitioner and she felt that they had blown her off and she could not handle the itching anymore. For the final prognosis that was given to the patient was lichen sclerosus, which is a rare skin disease that causes itching and painful patching of thin white wrinkled looking skin, which our patient was 88 years old, so the wrinkled looking skin could have just been bypassed. But it is more common in the genital areas, but can also affect other parts of the body overall, which is what happened with this patient, and the cause is unknown, but can be treated so the patient is not uncomfortable. For her follow-up instructions, she was to follow back up with the physician in a week, and it was important to have the physician monitor her symptoms so the progression doesn't decline and he can help lessen the symptoms and the patient isn't in any pain or discomfort. And the patient was to call back to the office as she was not able to get any rest and the medications were not helping her. The patient came back within 2 weeks and for her follow-up and was extremely grateful. Her skin was not reddened and had actually healed tremendously with a minor of there was no longer the bruising in her arms, etc., had gone away incredibly. The labs that were ordered all came back within normal limits and were unremarkable, which also fit into the initial diagnosis and helped rule out the other diagnoses, which resulted in the final ending of the patient having no more itching.